Welcome, and let's hear about a day in the life of a rural family physician.
There. Can you hear me?
Yes, we can.
All right. Well, my name's Scott Anzalone, as I said. I'm a solo family medicine physician in private practice. I also work part-time with the Heritage College of Osteopathic Medicine, doing some teaching, first through fourth years as an assistant clinical associate professor, and also I'm the director of our longitudinal integrated clerkship program. I have been in Logan, Ohio. Uh-oh, my screen's not moving. There we go. I've been in Logan, Ohio, which is in southeastern Ohio, just at the edge of Appalachia, for about 20 years, and about 3 years prior to that in southwestern Ohio at a FQHC clinic. Southeastern Ohio is pretty rural. One of the ruralest areas, Athens, Ohio, and just south of us, within 30 minutes, have actually one of the highest child poverty rates in our state. But in Hocking County, we have about 7 state parks and have a lot of tourism. About 7 million people come from around the country to see our beautiful parks and enjoy the wildlife, but that's just during the peak season, the summer. Other than that, we're pretty rural, small town. About 7,500, and the surrounding population is about 26,000 that we serve from a medical standpoint. This is Logan, just a quick picture of downtown and our courthouse. We are the county seat for our county. This is my office, is one of the oldest buildings in Logan. It was built in 1867, was the original stagecoach stop for Logan. They went from Columbus to Pomeroy. They were one of the original founders of Logan, Colonel Rempel, but lived here and owned the stagecoach company. This is my practice. Again, I'm actually the last private practice in southeastern Ohio. No, not southeastern, but in our region. I have myself, a nurse practitioner, 3 medical assistants, a filing clerk, and a receptionist. Also, we have a co-location service with Hocking County Behavioral Health. I do the medical management, and they do casework and counseling for child and adolescent psychiatry. Our goal, or my goal, has always been to provide care in a relaxed, home-like environment. My office is that perfect setting. When I found it, it's like walking into someone's home. We try to care for at least 90% of what walks through our door. I like to say I was the original medical home before that term was coined. But you can kind of see what our office looks like. The waiting room is on the far right. These are a couple exam rooms. Again, try to keep it very homey. Small town, you see your friends, your neighbors. It's like a little reunion half the time, most days. But again, the scope of rural family medicine is vast. And normally 90% of what walks through my door we can handle. We don't have a cath lab, but outside that we do quite a bit of things. My goal is to keep patients from having to travel. Our nearest big city is Columbus, which is about 15 minutes away. And Lancaster, smaller city, is about 30. But many of our patients would prefer to stay locally if they can. We provide cradle to geriatrics. I have to put a little plug in. It's one of my favorite pictures on the left. That's my daughter that I delivered years ago. I got the privilege of delivering my children and graduating my children. And she is graduating from college this May and getting married in June, which is scary and makes me feel really old. But it's about taking care of the whole family and the community. We have a Amish population here, as well as a large Mennonite population. I take care of most of the weavers. That encapsulates the entire Mennonite families, I think, here. But it's a joy to having helped deliver them and unfortunately at times bury them. But you get to know the families very, very well. So my thought would be to try to give you a snapshot of what my normal day is like. This slide and the next is just a snapshot of one of our schedules for the day. Typically, my nurse practitioner will see the acute things, colds, coughs, sometimes hospital follow-ups, those kind of things, and I'm seeing more of the complex, ongoing management and bigger problems. So, but my day usually starts around 6 a.m., get up around 6, I could be done on my computer at home, usually by about 6:30, and in about 20 minutes, get all my phone messages, prescriptions, faxes that have come in, get those taken care of and signed. That's one of the few benefits of electronic medical records. But then I'm usually out of the door before 7 or by 7 to get to the hospital, which is our local hospital is about 8 miles from where I live. It's a critical access community hospital. I'm usually there by about 7:10. In the past, I may have been there and back several times delivering babies or doing an admission from the ER or whatever. But now, primarily, I do see patients, some inpatient. We do have a hospitalist now, which does free me up. But I'm usually there doing endoscopy, colonoscopies, upper endoscopy. I will see patients of mine that are there on the floor more socially, but sometimes helping our hospitalists with insight and help guide them as they're caring for our patients. In the past, also did nursery care. Our local hospital no longer has an obstetrics and nursery unit, so I cannot do that any longer. So once I get done with the endoscopy, seeing patients, I'm usually trying to get back to the office by 8:15 to 8:30. And then my medical assistants are usually rapidly getting things going, doing injections, blood work, patients coming in for allergy shots, things like that. And then I start seeing patients. We average about 50 patients a day. Before electronic medical records, I used to see 45 to 50 myself. Now, due to the inefficiencies of EMR, we're down to about 45 to 50 between the two of us. Visits range, you can see there's this slide, and I'll put the next slide up. They range, it's like a box of chocolates, as Forrest Gump once said. You never know what you're going to get, which keeps it exciting, keeps it moving. There's never a dull moment. But what we care for here range from newborns. My youngest patient right now is about 7 days old, and my oldest is 101. So topics, it may be hypertension, diabetes, COPD, congestive heart failure, and frequently it's a combination of all those in one visit sometimes. Pediatric visits, well visits to acute care to, I swear I have a handful. I get these rarest genetic disorders that pop up in my office. Doing gynecology stuff. I still do everything but catch at 3 o'clock in the morning. So we do anything from dysfunctional uterine bleeding to prenatal counseling, endocrinology, hypothyroidism. I do a lot of male endocrinology, primarily testosterone replacements and stuff. We're seeing a lot more men willing to talk about it and come in, and we do help in that area. But just about anything endocrinology walks in, I rarely ever refer to an endocrinologist. Orthopedics, joint injections. I don't do fracture care. We do have an orthopedic surgeon in town, and I do let them do that just for risk, and they're here to help. We do a lot of rheumatology, lots of dermatology, and all the acute illness. In the past, I also, again, was doing high-risk obstetrics on top of all this, running back and forth, sometimes doing deliveries. But that's kind of a typical day. My surgeries, we do a lot of surgeries, usually first thing in the morning. I try to do it at the end of the day so I have more time, but mixed in that there may be some smaller stuff. But I included a list of things we typically do here in our office. And you can see that from circumcisions to, colposcopies, leaps, do vasectomies, joint injections. The endoscopy I do at the hospital. I put that in here, but the upper and lower endoscopy. Any kind of dermatologic surgery. Basically, my motto is if I can numb it, I'll cut it within reason. And I still do some in ICU, CCU care selectively. As you can see, when I was doing obstetrics, I did all my own OB ultrasonography. And I still do a little bit on the side of that. So that's, I'm gonna go back up one. So that's basically, management, seeing patients. Now, on top of all that, usually there's phone calls coming in constantly. There's refills that need to be done. Patients are calling in for. There's faxes coming in, documents that I have to review, sign, lab work that's coming back. Primarily arguing with insurance companies. One of the things I feel like I do half the day is just advocating for my patients. Because if we don't do it, no one else will. And the insurance companies then win. So I'm doing that. And then on top of all that, there's the office management component. I've got it down to a science, so it's not horrible, but managing my employees, payroll, doing the accounting, fixing the toilet, fixing the window when it doesn't shut or open, or putting out fires in the office that are happening. on top of seeing patients. So it gets very, very crazy sometimes. And it's a nonstop pace. So, looking at a practice like ours, what's the pros? You have autonomy. You can pretty much set your hours for the most part, but you are also under a lot of demand. So that's sometimes difficult, but you get a chance to treat patients how you want, not how a corporate manager is going to tell you how to take care of your patients. You're also making profit for your practice, not someone else. You can shape how you can shape your practice. So in the beginning, my practice was primarily women's health and pediatrics. Now, it still ranges from, pediatrics to geriatrics, but as I'm getting older, it's starting to age with me a little bit. I'm a little more geriatric patients, but again, the ages range. You also get to build equity, and there's less productivity pressure and bureaucracy when you work for yourself. And there's all the cons. I'll just leave them there. Paperwork, accounting, payroll, managing employees, fixing the toilets, all those things that you would just not have to do. Managing costs, keeping the doors open, making sure you can meet the payroll. And then long term is, your retirement benefits when you're self-employed. You got to keep that in mind and be creative and getting yourself ready for that time when it's time to call it quits. Biggest thing in our small community is employees, keeping good employees. There's always a shortage. So when we don't have someone or someone has to leave, it can add a lot of stress. But right now I've got a really good staff, and my goal is to keep them happy, because if they're happy, I'm happy. So the other thing, the other part of my life on top of all this is when you're in a small community, you're expected. There's this expectation to be part of the community. So it's not uncommon for you to be called to speak at different organizations, but to participate as much as you can. And the way I participated in my community is I'm on our school board and have been currently serving as our president. I've won 4 elections now so far. I think this will be my last. But I've had the opportunity to see my patients through the school. It helps me on the adolescent psychiatry end, because I can actually see I see them, I hear about them. I'm involved in our school, so I can see how they're doing. Another proud picture, this is me giving my daughter her diploma when she graduated. So it's a lot of fun. Yeah, I've been team physicians at different schools. So just lots of community opportunities that you'll be called to do. Being a rural family physician, in the case I am in, with a wide scope of practice, it opens up some global community involvement. I do mission work. I'm the medical director for the Village Mountain Mission down in the Dominican Republic. I do a lot of dental work when I'm there. It's a skill that I have here that I can't use here because I'm not a licensed dentist, but I have some dental training in the past, and I can use that on the mission field. So again, when I'm out there, pretty much I can help quite a few people because of the scope of practice that I have here, especially on the surgical end. Teaching on top of all this, I usually have students here. Right now I have a student with me today. She decided she was hungry, so she's having lunch. But these are a group of students that I took down to the Dominican Republic with me to get them involved in missions and to get their appetite whet. So I teach first through 4th years, and I do also have residents on occasion. When your scope is wide, it offers lots of opportunities outside your office to do other things. One of the things I've done over the years is I have worked for Holland America as a cruise physician. It's been a lot of fun. I was able to take my family with me and make a little extra on the side and keep my emergency medicine skills honed up. So that's got to see the world, let our kids see the world. So just a lot of fun. I work for the Ohio State Medical Board doing record reviews and chart reviews on the side a little bit. And then again at the university, my part-time job there. All in a day's work. So as you can see, there's a lot on my plate, and some days I think I'm crazy and I need to slow down. But you got to make time on top of all that. And so when I'm done here, my time at home is valuable. And I've learned as time goes on that time is worth more than money. And this is my family, my kids at least. The first gentleman is my future son-in-law in June. So I enjoy spending time with our family. And then you gotta have hobbies away from all this chaos. These are my other babies. So my little collection that I work on and fix, and the blue sports car I built. It took me about 3 years on the side, but that was my refuge to go out in my garage and just beat some stress out on some metal. You got to take time for the things you enjoy. Travel, which I love to do. We just got back I got to spend 2 weeks in Israel. Beautiful, beautiful land. And that's the Garden Tomb. It's empty for anyone wondering. And you can see the Dome of the Rock on Temple Mount on the right there. But again, my home is my refuge. That's where I spend most of my free time. I don't golf. I don't do those things. But when I'm home, I raise my own pork. Those are that's pork and beans on the left, and our couple dogs that keep the critters out of our orchard and in our land. We got chickens and turkeys and a horse, and enjoy horseback riding and hiking on my free time. I got to go and hike the Appalachian Trail with some buddies this last summer, which was nice to get away. So it's important to get away. Sometimes when you're in private practice in a rural town, it is difficult to get away. I don't have a partner yet. I'm looking for a partner. Anyone interested? I'll give you my phone number. It is that time I need help. But it is very enjoyable. It's very busy. It's very fast paced. The days go by fast. The weeks go by fast. But I wouldn't have done it any way differently. One of the things that I hear frequently is, "Oh, you're just a family physician." That gets my feathers ruffled quite quickly, because my usual response is, "No, I'm not just a family physician." I throw this out not to brag. I don't mean it that way, but I tell people, I said, I graduated second in my medical school class. I could have been a plastic surgeon. I could have been an ophthalmologist. I chose to be a family physician. I'm from a small town. I grew up in a small town. I knew I was going back to a small town, and what could I be? What could I specialize in that I could be more to many? And that's kind of what we do in this community. We provide 90% of what our community needs right here in our office, and have good relationships with subspecialists when we do need them in Columbus and neighboring communities. But that's kind of a snapshot. It's quick. It was a 10-minute, I don't know how long that was, but that's kind of a snapshot of my life and my day in my office.